Hello, and thank you for joining us for another episode of Hope for Healthcare with Dr. Katie Cole in partnership with ICD Healthcare Network. Dr. Katie Cole is a holistic physician, organizational well-being consultant, and change agent, working with industry leaders and proven strategies to heal our national healthcare system and our culture of medicine. Stay tuned to hear today's speaker.
Now you do have to do it, be careful how you do it, and really train the leaders, the manager of that clinic well in the process. The one other thing that comes in with that is following the huddle, then the manager will go around and connect with everybody in the office in the next couple of hours just to make sure they're all doing okay. And oftentimes aligning to whatever was discussed in the huddle, but also sensitive to what else might be happening out there.
So I hear you saying that maybe some leadership training is also involved in implementing the huddle. And
You're right. No, it is.
Yep.
It's really key. I know, training people, most people want to do a good job, and especially in healthcare, we want to be connected with each other, care about each other. We just don't always have the processes and tools in place to do that effectively in the middle of all the chaos that everything seems to feel like it's in.
Well, yeah. And as physicians, we really don't get any leadership training in medical school or residency unless we seek it out. Right. And so we're taught to be a leader. As a doctor, you lead your team, you lead your nurses and your patients in their treatment. However, when it comes to really collaborative leadership and interacting with the C-suite and management and advocating for what you need, we don't really have that training. And then you add in the chaos of the day and just being in reactivity mode. Our leadership skills kind of even go down further because we're in reactivity mode and upset and frustrated. So I think what you're discussing is very much needed in healthcare. And a lot of these concepts actually in themselves provide some additional leadership training for the front line.
Yeah, no, I love that you mentioned the reactivity issues because, we saw Mike Privatera present about these human factors and what impact they actually have on our physiology, on our anatomy. Increased cortisol levels driving more atherosclerosis. There's direct impact of burnout on the prefrontal cortex and our cognitive abilities, and on the amygdala and the way that we react to stress. All of those are actually, they're truly damaging us physiologically. And the opportunities to address, to reduce that damage, to just settle our systems and give us the capability to manage things better and reduce the onslaught that we're experiencing neurophysiologically as well is so important.